COVID-19 remains a public health emergency since the World Health Organization and the Centers for Disease Control have not yet declared any information which suggests otherwise. This was clarified by Health Minister Dr. Frank Anthony on Wednesday.
We take a lot of our guidance both from CDC and WHO. The WHO, they have a special committee responsible for public health emergency. That committee is scheduled to meet maybe in a month's time. And when that committee meets, it would evaluate where we are with the pandemic and then make a decision as to whether we continue in the mode that we are in, meaning that we have a public health emergency. So they would have to change that status. But as of now, the status has not changed, and therefore every country would have to be on alert.
Minister Anthony said the recent BBC report that the pandemic is over in the United States may not be entirely accurate.
I'm not sure that the report that the pandemic is over in the United States is entirely accurate. I do know that President Biden made a statement on 60 Minutes saying that he thinks the pandemic is over because of how people are behaving. But in the United States, I think they still have lots of challenges because they're averaging maybe about 400 deaths per day. Globally, we have about 1,600 deaths per day.
The health minister noted that persons have to pay attention to new strains of the virus like the BA2.75, which is more difficult to detect. The current strains BA4 and 5 cause milder symptoms for most people, but for a few there are complications. Minister Anthony noted that getting boosted helps the immune system to be better prepared to fight off the effects of the disease and prevent complications. However, getting people to return for their booster doses in Ghana is a challenge the ministry is currently facing.